Welcome, everyone. I'd like to welcome all of you taking the time out of your busy day to spend time with us. Thank you so much for engaging with us as a college and to joining us to learn more about some of our newest professional standards. My name is Mary Catherine, and I am the manager of the Practice Advice Service here at the college. I've been a practice advisor with the college since 2020. I am a physiotherapist and a proud graduate of the University of Ottawa physiotherapy program, as well as a U of T grad in rehab science. I've worked in a variety of settings as a physiotherapist, including acute care hospitals and rehab facilities. And prior to joining the college, I worked for 15 years in private practice as a clinician and as a clinic director of a multidisciplinary clinic. As a practice advisor, my role is to know the professional standards and help all of the partners of physiotherapy care in Ontario to also learn and understand how to apply the standards in their specific situations. I'm not, however, a health policy expert, but lucky for us, we have someone with us today who is, and I'd like to introduce you to my colleague Evgenia. Evgenia, would you like to introduce yourself?
Yeah, thank you so much. Hi, everyone. As MC has mentioned, my name is Evgenia, and I'm a policy analyst here at the college. I have also been here since 2020, and I've been working closely alongside the practice advice team and other college program areas to review our standards of practice. We are also joined today by a member of our communications team, Allison, who will be collecting your questions today and helping to manage the chat. All right, so today we will be guiding you through an overview of 4 new college standards that have taken effect on August 1st. And these standards are assessment, diagnosis, treatment, communication, duty of care, and risk management and safety. So let's begin. All right, so we have just a quick poll to launch right off the bat. So if you can all see that on the screen there, did you comment on the standards, this batch of standards consultation, yes or no? Just a really quick poll to gauge. All right, so we're seeing some numbers there. All right. Perfect. So thank you guys so much for answering right away. I'm going to share that with you on the screen. And no worries for missing any of the consultation. There will be plenty of time to consult on further groups of standards. And also the practice advice team is here to take any questions. And we'll be rolling those questions out as part of college resources going forward. But thank you for answering that one right now for us. I'm going to stop sharing that. And before we begin, I wanted to quickly talk about how the college has come to review its existing standards of practice and also to adopt new ones. So just to give you all an idea of how this all fits into our broader standards review project. So this one here is really just the first batch of a bigger process to align a national document called the Model Standards of Practice with the practice environment here in Ontario. So the national standards are a package of physiotherapy standards that really intend to create a sort of national practice alignment. It was put together by physiotherapy regulators from all provinces, and it was driven by practice data and with input from physiotherapists across the country. And I think many of you would have had a chance to participate in this one as well. So once the model standards are finalized, each province then takes that model and customizes how they adopt the standards to fit their own provincial context. In total, Ontario is adopting 16 of the national standards, and these will be reviewed in 5 batches. So you'll be seeing more standards roll out until the process concludes at the end of next year. So as mentioned with the consultations piece, the college posts public consultations whenever a new batch of standards comes forward, and these ones are communicated out to all registrants. Once the standards are approved in final form by the board, they are then posted to the college's website, and there's a 1 month transition time before the effective date, so before the standards actually come into effect, and that is 1 month after board approval. Now, how are the new standards organized? So the layout of the revised standards is just a little bit different than what you might be used to with the current ones, and all of the upcoming standards will follow the same consistent format. Here's what that looks like. So at the top, there is a standard statement that outlines the PT's expected performance. Next is the expected outcome, which describes what patients can expect when the standard is met in practice. And both the standard statement and the expected outcome then set the tone for the performance expectations to follow. And those are the set of actions that must be demonstrated for the standard to be met. So it's important to note here that while the standards are laid out separately, ultimately they are meant to be considered as one big comprehensive package, and that many of the expectations across the different standards will connect and work with one another. So once all the standards are approved, each one will also contain a list of related standards to provide that additional information. All right, so with the background out of the way, why don't we dive into this first batch of standards? And we are beginning with the assessment diagnosis treatment standard. So the purpose of the standard is to ensure that physiotherapists demonstrate that they are proficient and competent in assessment, diagnosis, and treatment to deliver safe and quality care to patients. It blends technical skills like, for example, using standardized measures with behavioral skills like clear communication and collaboration. The performance expectations first highlight that PTs must actively seek ongoing informed consent from their patients, so that patients are fully informed and know exactly what to expect for their care. The PT must use their professional knowledge, skills, and judgment at every stage of the assessment, diagnosis, and treatment process, making sure that they are all within the scope of practice and the PT's individual level of competence. So importantly, this process should be ongoing. The PT must monitor how the patient progresses and continuously reevaluate and adjust their approach as needed. Next, the standard talks about PTs recognizing when patients' needs are best addressed through either concurrent care or by another provider entirely, and they make the necessary referrals to ensure the patient's smooth transition in care. And finally, the standard talks about facilitating the patient's self-management of their condition by providing education about their treatment plan as a start. So now I will be handing it over to MC, who will take us through what this might look like in clinical practice.
Thanks, Evgenia. So this is a new standard for us. We've never had a standard that specifically set the expectations around what should make up our assessments, our diagnoses, and our treatments. Some of these expectations were found previously in the record-keeping standard, but they're now all grouped here for facilitated access. And adding a prognosis might be a newer concept for some physiotherapists. So what you need to know specifically in this standard, it does state that an assessment includes a history and a physical exam, and it guides us to use standardized measures where available. It also guides physiotherapists to show that clinical reasoning is expected, and it's expected to be used to determine a diagnosis and a prognosis for the condition that's being addressed. You'll notice throughout some of the newer standards that consent is woven throughout the standard, and it's specifically mentioned here that consent is part of the assessment and treatment, and it should be woven in as a continued conversation throughout your conversation with the patient. So how does this affect your practice? It might not. Hopefully, most of us have been performing assessments that include all of these elements. Some of the work around the diagnosis and prognosis might be newer for people who are newer to Ontario, but the focus on collaborating with others for both treatment and discharge, and that focus on transitions to self-management are also going to be might be a newer approach for some people. So some of the questions that were raised around the consultation phase of for the standards included the use of standardized measures. So what might some examples be of how standardized measures are used in relation to the standard? So of course, standardized measures, and they are defined in the standard, but it refers to the measurement tools that are designed for a specific purpose in each population. So it's information that is provided regarding the administration, scoring, interpretation, and psychometric properties for each measure. Outcome measures could be an example of a standardized measure, but also using a goniometer to measure range of motion or sit to stand to measure functional movement could also be other examples. Another question that we had was, are there any strategies for helping patients to achieve self-management? So as a practice advisor, what I would recommend is that the first step in achieving patient self-management is ensuring that we are setting meaningful goals for our patients. So this starts with your assessment, getting to know that person in front of you, ensuring that the goals for physiotherapy are SMART goals and that they're meaningful for the patient. You want to start to talk about and encourage self-management from the onset and continue to work towards this approach from day one. And then lastly, a third question that we often get from physiotherapists is, how do I refer to others? So if you're newer to Ontario or you're newer to Canada and you're not sure about the referral process, definitely speak with colleagues and get to know the scope of practice of other healthcare providers. Many conditions that we treat in physiotherapy require a collaborative approach, which can be challenging, particularly in solo practices and private practice in community settings. So take the time to become familiar with resources in your community. Don't be afraid to reach out to other healthcare providers to build that network of trusted resources for your patients. If you are newer to Ontario, you may want to review the video regarding collaborative care, which is found in our Transitions to Practice in Ontario resource. And Allison's going to post that in the chat for us today. All right, on to the next standard. Are you ready, Evgenia?
Yeah, thanks so much. Yep, now to move on to the communication standard. So this standard focuses on promoting clear, respectful, professional, and timely communication to anyone that a physiotherapist might interact with. And this might include patients, colleagues, members of the public, and professional communication ultimately helps to support patients in the understanding and management of their healthcare. Here, the standard highlights that professional communication with anyone in the circle of care requires honesty, transparency, delivering information in a timely manner, and avoiding communication that is disrespectful or misleading. When communicating about the patient, the PT must maintain confidentiality at all times. Next, expectations for communicating effectively with the patient include using active listening techniques to ensure patients feel heard and understood, and taking reasonable steps to address barriers to communication. Finally, the standard addresses social media and digital communication and outlines the boundaries physiotherapists must maintain for patient confidentiality and public trust. So this includes things like obtaining informed consent before using any patient likeness or information in their posts, not sharing anything that is disrespectful, dishonest, or misleading, and not providing specific treatment recommendations on social media platforms. Okay, MC, now how does all of this shake out in practice?
Sure. So again, let's consider what's new. And I think it's an important aspect to some of these newer standards is that they are regrouped and maybe renamed in some circumstances. But it's important to recognize that hopefully it doesn't feel to you as a physio like there's a lot of new things that you have to be adding to your practice. So the social media guidance, which is now found in the communication standard, has been a resource since 2022. So it's pretty cool that it's now wrapped into a standard. The concept of active listening is now in a standard. Again, this was information that was previously highlighted in our patient-centered communications module since 2023, and now it's wrapped into the standard. In terms of what do you need to know about the standard, I would say don't underestimate the effect of good communication on your patient's care. It's really woven through everything we do as physiotherapists. It's the special sauce that makes our treatment that much better. It can enhance your patient outcomes and really improve a patient's experience with their physiotherapist. So a lot of you are already using techniques of active listening. In case you aren't, now is really the time to consider building your communication toolkit and your skills. Again, that patient-centered communication module is free and available on the college website, and you can review it at your own pace to build on your communication skills. Allison's going to post it in our chat again today, and it's linked to the communication standard as well. You'll also see that consent comes up again in this standard, and it's such a big part of communication. It's that ongoing conversation with your patient. And consider that if there is a language barrier with your patient, it will need to be addressed so that consent can be adequately obtained. So one of the questions that we received about this standard included the concept of timely. So how does the college define timely in the terms of timely patient communications? Well, really, this is going to be left up to you to use your clinical reasoning to determine what is appropriate in your clinical scenario. The college is not going to put, it has to be within 3 hours or 24 hours or something. It's really situation specific. So, for example, it might mean getting information entered into your hospital's EMR system within a few hours so that the weekend therapists or the PT assistants have the information that they need. It could mean that you have a longer report to file by a specific date so that further funding for a patient in a community setting could be approved. With regards to the standard and communications and social media, we want to make sure that we're always considering how we are using the communication with a patient if it relates to clinical care has to be included in the patient's record. Again, this isn't a new concept to include communication related to clinical care. That's always existed as guidance at the college, but now you'll see it here in this communication standard. Okay, so we have a quick quiz for you to see how everybody's feeling and to just touch base. So if you could answer this question, how do you define active listening? So what do you think it would be an example of how you're considering what active listening is? Maybe it's something you already apply in your clinical care. Maybe it's a newer concept to you. Yeah, you guys are nailing it. I mean, of course, sitting with your arms uncrossed does show that you're open and ready to receive information. But there's very specific techniques, absolutely, that are used. Techniques such as paraphrasing, summarizing, validating, and clarifying techniques are all examples of active listening. Okay, let's jump into the next one. Thanks, everyone, for participating in that quiz.
Yeah, thank you, everyone. You guys rocked it. All right, so next is the duty of care standard. And this is actually the only standard in this batch that is not a totally brand new standard, or sorry to rephrase, not something that we had as a standard at the college before. So this one was formerly known here as the providing or refusing care standard, and it covers largely the same things. So why is the standard now called duty of care when previously it was called providing or refusing care? Duty of care in a healthcare context refers to a provider's ethical and legal obligation to act in the best interest of their patients to ensure safe, competent, and compassionate care. So for physiotherapists and for the standard, this means facilitating shared decision-making, providing care without prejudice or bias, and preserving the continuity of care. So overall, putting patients first in their care planning. A key principle in this standard is that the patient be treated as an equal partner in the care plan, meaning they should feel respected, supported, and involved in their care. So the standard gives some ways to achieve this, like the PT engaging the patient in shared decision-making, which includes educating about their condition, supporting their overall health literacy, and respecting their rights to make informed choices about their care. Physiotherapists must also provide care without bias or discrimination, meaning they comply with Ontario human rights and accessibility legislation, and they do not discriminate against a patient's lifestyle or any protected grounds when providing services, making referrals, or ending the therapeutic relationship. Should conflicts with the patient arise, they must be resolved in a respectful manner. The standard then goes into the expectations around ensuring continuity of care. So this means that the PT is responsible for providing ongoing care for patients who need it, such as making sure that there are other arrangements in place when the physiotherapist plans on taking some time off. And like with the former standard, it also outlines the circumstances under which a PT can discontinue care without providing for the continuity of care, as I just mentioned. So this includes several things, but it's things like patient preference, the patient's failure to pay in a reasonable time, patient being abusive, or the breach of a professional boundary. So full list is in the standard. And finally, the standard talks about the duty to provide care in emergency situations, such as a global pandemic for an all too familiar example. And this part of the standard was actually carried over directly from the providing or refusing care former standard that we had. Okay, and now I will call back on MC, give us all a clinical practice lens.
Sure. So as Evgenia mentioned that a lot of this information was found previously in the providing or refusing care standard. Some of the newer concepts in this standard for some physiotherapists will include that facilitation of health literacy and self-management through education and shared decision-making. Ensuring that we're only providing care that is clinically indicated is also part of this standard, which used to be found in the conflict of interest standard. Importantly, the standard does require physiotherapists to not allow their personal judgments about a patient, the patient's lifestyle or health choices to compromise the physiotherapy care. And the physiotherapist does not withdraw from or refuse to provide care to the due to the physiotherapist's judgments about a patient, the patient's lifestyles or health choices. And the other piece around this standard is that it requires us as physios to comply with the duty to accommodate the needs of a patient arising from protected grounds under the Human Rights Code in a manner that respects the dignity, autonomy, privacy, and confidentiality of the patient. So how does this affect your practice? The standard might challenge you to examine your practice and approaches to ensure that you're providing unbiased care. Alternately, if you've had experiences where you've had to manage a situation where a patient maybe became abusive to you or your staff, this standard will guide you in how to approach and resolve the situation, including conditions that should be met if you're considering discharging a patient from your care while they're still in need of physiotherapy. So questions that arose during the consultation phase of this standard included asking us for some examples of scenarios where discharging a patient might be appropriate with or without ensuring continuity of care. So first and foremost, the college would not want a physiotherapist to put themselves in an unsafe situation. So if you as a physio believe that the patient is being abusive, either physically, verbally, emotionally, or sexually, towards yourself as the physio or others within your practice setting, or the physiotherapist has reasonable grounds to believe that the patient may become abusive, it might meet the requirements within this standard. If you as the physiotherapist conclude that a professional boundary has been breached, you should consider the steps that could be taken to manage the behavior and restore the boundary. And if all reasonable steps have been taken to manage the behavior, and it hasn't been successful, it might be appropriate for discharge. If you ever have further questions around your circumstances, please give us a call at Practice Advice and we'll help you consider what is relevant in your scenario. Okay, Evgenia, we're on the home stretch. Last one.
All right, we're on the home stretch with the risk management and safety standard. So this standard is really about creating a safe physiotherapy environment through measures that both anticipate the risk before it happens and respond to it when the risk is present. This standard is divided into 4 sections, and those are risk identification and mitigation, physiotherapist training, patient interactions, and responding to patient safety incidents. So first, the PT must identify potential safety risks depending on the practice setting, treatment approaches, and population served, and apply best practices to address them. They must participate in training and develop competency in safety protocols that are relevant to their practice. They ensure patients' day-to-day safety by providing a clean and hazard-free environment and confirming that any machinery they use is clean and working properly. And the last section is about handling patient safety incidents, which refers to any event that could have or did result in unnecessary harm to a patient. The standard requires that patient safety incidents be recognized, documented, and reported promptly and transparently, and following any workplace policies and procedures. Okay, now for the final time today, I'll turn it over to MC.
Sure, so thank you. And what's new about this this standard is really the equipment maintenance piece already existed with infection control previously, and now it's wrapped into this risk management and safety standard. It sets a tone for physiotherapists to create a culture of safety wherever they provide care. The documentation of safety incidences and near misses might be a newer approach for people who are working either as solo practitioners or in private practices. So you need to know and recognize that equipment maintenance requirements are not new. This has existed for a long time with the college, that the physiotherapists are required to ensure that any equipment and modalities used are calibrated and maintained as per their manufacturer's recommendations. And you should also consider that the equipment maintenance records should be stored in the same way as your physiotherapy records. How this affects your practice might depend on your work location. So consider if you're working virtually or assigning care to a PTA at another location, you are still responsible for the equipment being properly maintained. It also compels us to consider our emergency preparedness. For example, if you work in an environment with patients who are at risk of cardiac events, do you have staff who are trained in CPR, or do you have access to a defibrillator? Do you have a plan for a patient with an adverse event if you are alone in a clinic with a patient, and how that's going to be managed? So some of your questions around managing patient safety included having patient safety protocols. And so we do have some resources at the college that help you to put some safety protocols together, including some examples. And we also have a form that you can download called a critical incident report that could be used to record near misses as well as actual events that have occurred to help you consider how to prevent them from happening in the future. And the other piece was that these safety protocols are typically different than the written management of adverse events that are required for your rostered activities. Okay, that was a lot of information in 27 minutes. So we thought we'd just get a pulse check here from you and get a sense of what are your reactions to these new standards that have been rolled out. Are you feeling great? Are you feeling, oh gosh, more work for me? Are you know where to turn to find them? If you have any questions, please consider sending them to Allison in the chat. Okay, so any questions regarding these can always be sent to us. You can send them directly to Practice Advice. You can send them to Evgenia with the policy group and the feedback email. What is that feedback email again, Evgenia?
Yep, so it's consultation@collegept.org.
Great. So our next webinar is going to cover the second batch of standards, which includes the titles, credentials, and specialty designation standard, as well as the evidence-informed practice standard. And as we'll talk about the new code of ethical conduct as well. If you ever have questions for us on Practice Advice, you can contact us either by email or phone. We are an anonymous service. If you prefer to maintain anonymity while you're asking us questions, you can also do that. We welcome your questions in any capacity. And there you go. There's our contact information. Okay. Well, it looks like we don't have a lot of questions. Oh, we do have a question. All right. So we have a question around prognosis and how it applies for physios working in a hospital setting or for patients with cardiorespiratory issues. So remember, the prognosis is going to be related to the physio diagnosis. So it wouldn't be up to us to give a prognosis around a medical diagnosis itself, but more related to the physio goals of treatment and the diagnosis itself. So keep your clinical reasoning focused on that, and that will help you to determine with the patient what the typical course of recovery would be and what you would expect their prognosis to be. Great question. All right, everyone. Well, it's 1 o'clock. We're ending right on time. Again, thank you so much for coming out in such big numbers. We look forward to getting to hear from you again and chat with you at the next standards webinar. Thanks so much for coming. Bye-bye.